Today I want to go over a couple exercises that you can do before your respiratory treatment to kind of loosen things up. Think of it as like a warm-up before you go work out and stuff. So the goal is to kind of improve movement, increase core temperature to let the elasticity of the muscles kind of lengthen and stuff like that. And that's the same thing with respiration when you're trying to do breathing treatments. The more you're able to allow the muscles to move and help you clear that mucus, because that's kind of the end goal, the better approach you're going to have. So today we're going to go over two exercises. The first one's going to focus on the rib cage. We're talking a lot about this, so if you have more questions on what we're talking about with the rib cage and rib cage expansion, check out our YouTube channel. But we're trying to expand those ribs so we can get the diaphragm down and open up the lungs. And then what we're going to target is the shoulder blade on the back so we can kind of loosen those up. So as a unit, the rib cage, the shoulder blade work together when you raise your arms. But even when you're breathing heavy, there's this elevation. So you get neck muscles that connect down to the clavicle on the front, which then connects to the shoulder blade, and the muscles connect to the rib cage. So all of this works together in unison to help you breathe. So if we're able to get better movement quality there before your respiratory treatments, then it may help clear the mucus a little bit more effectively and make it a little bit more. Okay? So first exercise we're going to focus is on that rib cage. So I'm going to eventually be at the wall, but right now I want to talk about, you're going to breathe in as much air as you can, and when you exhale, you're going to think about tucking your rib cage down and back. Alright? So you're going to breathe in, and then exhale down and back. Once you've exhaled, you're going to keep it there, and then you're going to take your next breath. So you're kind of locking that rib cage down. What we're going to do is we're going to add this to the wall by putting your hands about shoulder width apart, okay? And they're going to be about in line with that shoulder. From that position, you're going to bend your knees slightly, okay? And you're going to breathe in as much air as you can. And then you're going to exhale all you can. Stay there, breathe in again. So every time you're taking a breath in, I'm exhaling, and you see my knees are going to bend forward, my rib cage is going to come down, and I'm connecting and building that gap or closing that gap between my rib cage and pelvis, which is going to get those abdominals to work, but it's going to help the diaphragm clear all that air, which could eventually possibly help with clearing that mucus. Now, once you've done about 3 to 5 breaths there, so I finished my last breath, I'm going to kind of shake it out. I'm going to go back to the wall, turn around, bring my feet out a little bit, about 1.5 feet, go into a quarter squat position. The key with this one, if the wall is behind here, I'm going to keep my lower back against the wall, keep my back and my head against the wall. And then what we're going to do is wall supported Y's, or overhead reach. So what this is the back of my head, my upper back, my lower back are in the wall. My arms are going to stay locked out. You don't want to bend the elbow. And then you're just going to look straight ahead, reach, get your thumbs to touch the back of the wall, come back down. So what we're doing here is we're getting the shoulder blades back here as we raise overhead to wrap around the rib cage, which is kind of what their job is to do. Now when we add the wall, it allows us not to arch. So if you do this just standing, a lot of times we're going to extend our rib cage up. It's fine to extend, but sometimes we excessively do it and we start to use our lower back to get it. Another thing you want to be careful about is if you don't have that much range or you have tight shoulders, what can happen is the elbows will bend and you're going to get back there. Try not to allow those elbows to bend. So it's going to be better just to go to here versus bending the elbows here. Now, if you do have a little bit more restriction in the shoulders, one thing you can do is think about creating the world's biggest arc around your body. So I'm going to reach out, keep my head and lower back still on the wall, reach out, and then come back up. So this is going to allow to kind of lengthen adding this component. So these two exercises, you start with the rib cage, doing the breaths. Look straight ahead because you're going to want to tilt. Make sure you're not pressing into the wall, just place your hands there around the rib cage. After 3 to 5 breaths, tuck the head, lower back. You do 6 to 10 repetitions of wall supported walks. Very simple and quick warm-up exercise before your respiratory treatment. If we help improve or loosen up the rib cage and the shoulder blade, it's going to loosen the neck muscles. It's going to loosen all those secondary muscles that really kind of take charge when it's hard to breathe. So try that out before your respiratory treatment, morning, night, whenever it may be, and see how it goes. But just think about before you're doing these things, if you warm up the body a little bit before, it doesn't have to be crazy, just a little bit of movement, it can help that end goal of getting all that mucus or clearing all the mucus out.